Okay, I'm going to call the meeting to order at 6:11. Thank you all for being here. We'll start the meeting by trying to approve the agenda. So can I get a motion? Second?
Second.
Thank you. Okay, the only thing I know is that we are going to move the presentation from the doctors to right after we approve the agenda, and then we'll move through the rest of it after that. Is that okay with everyone?
Yes.
Okay, is there anything else we need to add or subtract?
No.
Okay, all those in favor of the agenda, please signify by saying aye.
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 All those opposed? Okay, thank you. So tonight we have with us a couple of doctors online and a couple here in person to talk to us about COVID-19 and children. So I would love to open it up to you guys, whoever wants to talk first, or...
Sure.
Sure.
Do I just sit here?
You can get up and do whatever you want, or you can...
The microphone's here.
it's right there if you want to talk.
But it should pick you up, but if you could just,
Should I?
these won't really, those are PEG TV, this one will broadcast. If you don't mind, actually I need to turn on the recording, starting with your name, that would be awesome.
Right.
Recording in progress.
That sounds serious.
Yeah, right?
My name is Stephen Wood. I'm a pediatrician. I've been working in Rutland for over 20 years now. I have 3 children. I have one who's a sophomore here at Otter Valley, and my 2 daughters also attended in part Otter Valley here. So I have great esteem for the staff here and the teachers and the board members. Very much appreciate your hard work and navigating this difficult time, very much so. For sure, I mean, it's pretty clear from the news that, and my personal experience that, offline, non-in-person learning is really, the kids are missing out inevitably, and they're losing some education for sure. And so keeping kids in school is going to be a priority, absolutely. And I think that should be something that we aspire to and really seek to protect. Vermont has weathered the pandemic extremely well. In part how rural we are, but we've made some really good decisions. And Otter Valley was a part of that. In fact, by many measures, Vermont has really done an exceptional, they're on the podium. They're really on the top tier as far as how well we've done with the pandemic. There was a time that it seemed like there was going to be a parade for the end of COVID that we were all getting psyched for. We were going to have a bonfire with our masks and you celebrate. And it just seemed like we were almost there, and the Delta virus showed up and dampened that enthusiasm pretty miserably. And as you, I'm sure, are aware, that so many hospitals now across the country are at capacity for the amount of patients that are now present in there for COVID. Pediatric cases have gone up not 2 or 3-fold, but 5-fold over the last month. This is insane. And this is really due to this very infectious virus. This is a mutation from the coronavirus, which is the Delta virus. So that's been really discouraging for sure. So Delta virus is about twice as infectious as the ancestral variant. And really it's a flame. That virus is a flame, and the kindling is the unvaccinated in our community. And right now that kindling is inevitably the kids that are 12 and under, or under 12, because they're not able to get vaccinated, but also those parts of our community who have chosen not to get vaccinated. And so these are folks that are very much at risk, and as that kindling gets ignited, others who are vaccinated are also getting burned in the process, and we're seeing that already, some breakthroughs. So as we ready ourselves for the fall and winter, it's critical that we get back to the mitigation strategies that have already been shown to be effective, and we continue them. I'm not saying that we've slacked on that, but I know we were ready to put the masks away, but I really think that as we approach this fall and winter, we need to continue those important strategies. The most important really being the receipt of the vaccine. And for those that can get it, it's safe and it's incredibly effective. And then also masking. I think that's going to be really important for us this fall and winter and going forward. We're not at a place of security that we can let down our guard, and masks are well tolerated and effective and should be an expectation going forward into the school year. Thank you very much.
Thank you.
Thank you.
Hi there, Dr. David Schneider. I'm Associate Medical Director for Community Health Pediatrics. Just thrilled to be here with Dr. Wood, Dr. Loveco, and I. We have about 80 years of commitment to this community together between the three of us. And thank you for the other physicians and everybody who's here who's willing to join us. Dr. Wood made really the most important points in general. We are seeing a peak, actually primarily in pediatrics in particular. Children's hospitals are being overwhelmed with pediatric illness. COVID-19 has this reputation of not really affecting children. And from the beginning, that has not been true. Thank goodness the mortality rate is extremely low, but we cannot ignore the morbidity rate, which is significant, and it seems to be becoming more and more significant. We're seeing long COVID in some of the teenagers who have had it prior. Still, there's a lot of unexplained multi-system inflammatory diseases in children. And we certainly, even just in our little island in Vermont, in Rutland, have seen sick children. So let's never dismiss that this is not a pediatric disease. It certainly is. There was a large statement, a large request, almost a begging statement by the Pediatric Hospital Association that was published at both ends of the country, one in the Los Angeles Times, the other in the New York Times. It was yesterday or the day before, just asking for common sense that we know for the things that work, that help mitigate the illness. Social distancing, wash your hands from time to time, wear a mask, and most importantly, if you can, be immunized. We know immunizations, there are some breakthroughs, we know there is some transmission, but we know that it is a much lower rate. Hospitalization and death right now is a non-immunized person disease. Very high 90% of hospitalizations and death are people who have not been immunized. Of course, you will hear sensationalization of the few that will always break through. Nothing is 100%, as we all know. But without a doubt, immunization is going to help be the primary role out of here. Right now, children under 12 cannot be immunized. Certain medically complex people cannot be immunized. They first of all, children will get sick, most likely will not die, thank goodness, but will certainly be spreading through communities and could potentially spread to immunosuppressed other children, immunosuppressed adults. And we see the spread within families. We certainly do. All the physicians do right now. Social distancing is understood to be something very difficult to be done in schools. It's just very difficult, and we want our children to be in school. So we have to do the next best things. Encourage immunization for those who are over 12. Many in schools are not over 12. So we have to do the two remaining things. Again, reasonable hygiene and wash hands frequently. Stay home if you're sick. Even if you think you're sick, perhaps hesitate to come in. And wear masks. Masks work. We know they work. They work, again, especially when you're not able to social distance, especially when you're not immunized. Okay. Masks have been used in medicine as a matter of routine in the OR for about 100 years or so, let's say. Imagine a surgeon deciding not to wear a mask because he's uncomfortable or has liberties and doesn't want to. you know? And again, the surgeon is wearing a mask, not so much to protect himself, but to protect the other person. Okay, masks simply do work. Okay, now do they add if you're outside, if you're social distance, if you're immunized, if you're well? Do they add a whole lot? Probably don't have to add a whole lot. That's okay. So the standard was to take our masks off in places like that. They were not adding a whole lot to our protection when we were immunized and our rates were low. And finally, you know, in support of the American Academy of Pediatrics, one very important point they make is we have to stay flexible. The rules today are going to be different than the rules next month, as they were different than last month. Whatever the board decides, and of course all the physicians support the American Academy of Pediatrics stance that everybody should be masked in indoor settings where you cannot socially distance, such as in schools. But be prepared, you know, to adjust and visit this again, hopefully for the better, really, and hopefully soon. We know coronavirus loves to mutate. It's what it does. It's what, you know, that's what viruses do. Coronavirus is known to do that. So Delta's not the last of things. As Dr. Wood pointed out, Delta has been very aggressive, and as Dr. Lovecoat pointed out in a letter, when you look at its level of contagiousness, it approaches about 1,000 times that of the original strain that we identified. So it's extremely contagious, and that's why we're seeing so much peaking of COVID around the country right now. I could speak all day, but I'll let other people speak. And I'm happy to answer questions, as is Dr. Wood.
Thank you very much, Dr. Schneider. Dr. Rubin's hand is up.
Sure. I'm Elliot Rubin. I'm a pediatrician living in Plymouth, Vermont, and I'm starting my retirement after 36 years private practice, so thank you for allowing me to speak this evening. I certainly agree with the Vermont, with my two fellow pediatricians who've spoken, and with Dr. Loveco, who I believe is going to speak, and she's written a letter as well. And I agree with the Vermont AAP, American Academy of Pediatrics, in their support of certainly getting children back to school. Also, the Vermont AAP, the Vermont Medical Society, and the Vermont Family Physicians do support the continued universal masking regardless of vaccination and rate. And this is also the position of the CDC and the American Academy of Pediatrics nationally. There's a lot of other reasons besides COVID. It's great mitigation for COVID, but other respiratory viruses are, last year we basically didn't see flu and RSV until we started unmasking sometime during this summer. And certainly, basically we want to be able to mitigate against that because it decreases absenteeism, people missing work, and also complications. So we really should be having, this continued universal masking until all children less than 12 can be vaccinated, and when the data says that it's safe to do so. So also, obviously, staying at home when you're sick, and we have guidance on how to decide when it's okay to come back. This plan is also consistent with the CDC guidance for all of us, that basically we should be wearing masks indoors regardless of vaccination status. And that was just basically reiterated for Dr. Levine for Vermont, because it involves when you have counties with high transmission, with high rates, and all of Vermont counties unfortunately do. So, I do think Vermonters should be very proud of what they've done. We have one of the lowest rates of disease and deaths due to COVID. We have a very high rate of vaccination. But as been said before, we really should not take this for granted. We should take this seriously. Things can take a turn for the worse. If you think about it, there's been other places, California, for instance, Australia, Vietnam had really early success stories, and then they turned around the other way. So we should take that as a caution. As was said, even though Vermont has mostly been compared to children getting seriously ill, there still have been over 6,000 cases in Vermont. And this can be a serious disease in children, as we're seeing in other parts of the United States, with 400 to 500 deaths nationwide, and complications such as myocarditis, long haul syndrome, chronic fatigue, etc. So I just want to conclude by saying, looking at my professional life over the last 4 decades, it's now more important than ever for our community to come together. We need to listen to what the science is telling us. We need to protect vulnerable populations, including unvaccinated children. And you know what? We can do this. We all need to just be rowing in the same direction, and we'll get through it. Thank you.
And congratulations on your retirement, and thank you for
Thank
serving
you.
the community. Dr. Lovko, I noticed that you unmuted. Would you like to speak?
Sure, yes. Thank you for having me. Yes, I'm Indra Lovko, and I've been a pediatrician in Vermont for 21 years now in Rutland. And I also have served for several years on a school board, so this is not an entirely unfamiliar setting to me. But I mean, I agree 100% with what my colleagues have said. And basically, I mean, I won't repeat what I wrote in the letter, and perhaps Jean shared it with all of you before the meeting, but I just wanted everyone to kind of know where I was coming from. But I think, you know, without masks, with Delta causing considerable illness in Vermont right now, we can expect that a lot of children will get sick, and not every child will do well. And then their vulnerable family members and others in the community also may not do well. So that's really the rationale for masking for now. And, you know, I sympathize with people who have pandemic fatigue, COVID fatigue, all of this fatigue. You know, as a healthcare provider, we have the fatigue too, believe me. So hopefully with immunizing more of our population, you know, we'll be able to get over this bump. But that's really, I agree with what everyone said.
Thank you. And for our audience who didn't get it, there is a copy of Dr. Lovko's letter right on the table over here, if you'd like to read it. And I did pass it out to the board members. Thank you. Dr. Myers, would you like to add anything? Dr. Myers, would you like to add anything?
Oh, I'm sorry. I didn't hear you. Yes, I'm Dr. Myers. I'm a family nurse practitioner in Brandon. I live right in the community, and I have, you know, strong ties here in the community, and I love this community. I agree with Dr. Snyder, Dr. Lovko, Dr. Wood, Dr. Rubin. You know, I worry about our children. I also worry about our older adults. I tend to see more of our older adults who are at risk. And I think it makes sense. I mean, we saw very little illness last year when the kids were masking and we were remote. We didn't even have flu. We didn't have RSV. I mean, it was fabulous. We had some great, you know, health for our families. And I think this is, for me, a no-brainer. But I came to support my colleagues in their request.
Thank you. And Dr. Bell, would you like to add anything before our chair opens up for questions?
No, I don't really have much to add to all this great discussion about masking. We're also available to chat about, masking is one piece of Safe Schools, and I know there are lots of questions about, we might be able to be helpful about around other stuff about how to schedule the school day, and, we collaborate with the school nurses around this as well. So happy to answer questions about that.
Thank you. Turn it back to you, Lori.
Okay, so at this point, does anyone have, from the board, I would like to hear from the board first. Does anybody have any questions for the doctors?
Kevin.
Go ahead.
I'd like to know what's different from last year. Last year we shut down, and you're recommending that we don't this year, as far as I can understand. So what has changed? Why should we be less concerned with social distancing and be confident that the masking is going to be enough?
I think that's a wonderful question, an excellent question.
Dr. Snyder, I'm not sure if you're
Yes.
caught on the speaker. If you could-
So I'll start and we could take it from there. We knew nothing last year. This is a brand-new virus. We knew absolutely nothing, and we just knew that, man, people were dying, and a lot of people were dying quickly, and an agonizing death, let's add. And so, as we did not know how children would behave with the virus, we didn't know how sick they'd be, how they would transmit. We knew almost nothing. It's a brand-new virus. Compared to, I don't know, influenza, been around since prehistoric times, chickenpox, been around forever and a day. These are well-researched. We understand the way things go with measles. But this was just something brand new. So we had to do something. Not me personally, but I certainly supported it. There had to be a response to err on the side of every precaution you can. And frankly, I shouldn't say me personally, because what we did from the medical perspective also, we shut down our offices. We just went straight telemedicine, and we saw patients in tents. We just didn't know how this was going to transmit. And our organization, diligently, we learned, and every single now facility has incredible ventilation, UV protection, all these things that everybody in the community was trying to do as we were learning and learning and learning. So, how does it spread? It's through respiratory secretions, it's through droplets in the air, both which could be protected pretty well by masks. But we didn't know that. We didn't know, was it being transmitted through just skin-to-skin contact, through people were checking sewers, right, to check for how these things are being spread. So now, as the knowledge has been gained, we understand that there are safe ways to work with each other and be with each other, safer ways with COVID. We also know that almost everybody hated closing down the schools, and how important socially schools are to our children. They just all couldn't wait to go back. Many, as school board members and as parents understand, almost lost a whole year of school. So we want to do everything. We support the American Academy of Pediatrics. All of us want to support any reasonable way possible to get back in school. Now, you probably heard already, schools are closing down, right? Right away, schools are closing down again because of COVID. What's happening, okay? And we're going to see more and more of that happening in unimmunized, unprotected places. You can bet on it. Even other countries, some countries are choosing not to mask. They're choosing other ways to go about things, through quarantining, through shutting down, through video conferencing. Okay, go ahead. It's your choice to wear a mask or not. But it's you're more likely going to have to shut down again. So hopefully we're going to be able to keep it open the whole time. I don't know that we will. I think these are the mitigation measures that give us the best chance. Finally, social distancing would be ideal, but it's understood that it may not be realistic in closed settings like this.
Thank you.
Thank you.
Becky? Bertrand?
Yep. What do we say to parents of young children who feel like masking all day interferes with their breathing? And then second part of that question is, what do you recommend for kids who are having a hard time keeping their masks on?
Anybody can answer.
I could talk all day. We just don't see that in children. And by history, that's just not the case with masks at all. Again, surgeons wear masks, and all OR staff, hospital staff, will wear masks for 18 hours straight without a problem if they need to. Masks, it's nothing new to wear masks in a medical situation all day long. There's not a section of the hospital ward for people who wore masks who got sick. It just doesn't happen, We'll have patients come into our office earlier this year where they were uncomfortable doing it and they were concerned about that. And we were happy to put anybody on a pulse oximeter and watch them as long as they want. And there was a zero change. Pretty much there's just zero change. People wear masks all the time without any problem. Now, are some people have tactile issues with them that might need to be addressed? Possibly. Are there rare exceptions, for example, somebody with severe delays, perhaps severe autism, who just simply cannot wear a mask? Little young children, of course they're not going to wear a mask well. They're just not going to wear a mask well. And we do the best we can. You know, under 2, I think the recommendation AAP is 2 years and up. The reality is we have a ton of 2-year-olds in our office. They wear the mask on their head, on their feet. We do the best we can, you know. But for the same reason, that's why we want other people around us wearing masks, because that other person who's not wearing it properly might be at risk of contagiousness. But it's just not the case. I mean, masks are just, they just don't cause hypoxemia. They just don't.
And I would add, as the superintendent, that our youngest children don't have an issue with wearing masks during the day. It has not. There are a couple of kids that we, especially in the beginning, needed to teach how to. But it really, all the way down to our pre-K kids, they're wearing the masks.
I think our experience, we were inundated with requests for medical exemptions for masks, for really just because parents were very concerned about this issues early on in the pandemic, when, oh my God, my child has to wear a mask, not a mask. They just stopped short. They suddenly realized, you know, the kids will wear masks fine. They just, you know, plus they got to pick out different, you know, it just became, I don't know, is the equivalent of wearing socks to a certain extent, you know? I mean, it's not, it just becomes another garment that really, we just don't see children complaining about it. And parents are not coming to us, with very rare exception now, compared to the beginning of the pandemic. They're just, you know, it's just not an issue that we're experiencing.
Lori, I thought Jean had a pretty cool comment in her letter to the parents. She said that we're treating masks as part of the dress code. You know, and from this point on, it's part of the dress code. So I thought that was a pretty cool way of looking at it.
I think in Asia, it's been that way, you know,
Yeah.
for quite a while. And again, they're just not dropping from hypoxemia either. You know. They're not being developmentally delayed. They're not, you know.
In Asia, it did start with air pollution, not illness, and not protecting from illness.
Dr. Lovko has her hand up.
Okay.
Just, no, I'm just, that was my understanding when it started in Asia with the masking. It was years ago, and it had nothing to do with illness. It had to do with the fact that the air pollution in China was as thick as you could cut it with a knife. And it was protecting themselves from the air pollution. I may be mistaken.
Okay. You said Dr. Lefko?
Yes.
Dr. Lefko, go ahead.
Yeah, hi. As far as the mask not fitting well, we see that in our office. So if a young child shows up and, you know, you'd think that by now the parents would find something that fits well, but sometimes they still haven't. But we have, you know, obviously extra masks in our office, different sizes, so we can always find something that will fit the child well. I don't know if you can do that in your schools, but sometimes you do have to trade out a mask for something that fits better, you know, because we've all seen the ones that are just too loose to really do anything effectively. And the kids are amenable to that. They're fine with it.
Okay, thank you. Are there any other questions from board members at this point? And then I'll open it up to everyone else.
Natalie.
Natalie, go ahead.
What percentage of the unvaccinated cases in Vermont are of children who are under 12? And also, what type of mask would you recommend for our unvaccinated children? I have one son who just likes the thin cloth mask, but I worry that's not giving him the protection that he needs. Does he need a KN95? Does it need to be 4 or 5 layer mask? What would you recommend for the unvaccinated kids?
I can't give a personal, maybe Dr. Bell knows the exact percentages of unvaccinated in Vermont and how many are children. Data on masks are a simple, appropriate, it doesn't have to be a KN95 mask. It just has to be a well-fitting, comfortable mask. Surgical is better than cloth apparently, but I think cloth is reasonably acceptable. And again, perhaps Dr. Bell has some of these answers.
The other thing I've heard is just to not, from the experts that I've heard, is not a mask that's a gaiter that they just pull up. That's not a mask. That it should be a real dedicated mask.
Dr. Bell, do you have any statistics on what percentage of cases in Vermont are unvaccinated kids, by any chance?
So I can, if you're okay, I know we're not using the chat, but I can put the link to the VDH data summary, the most recent one.
Go ahead, I'll open the chat for you.
And I'll say what page it's on. So the health department gathers data by like decades. So it's 0 to 10, and then 11 to 9, above 10 to 19. So the 0 to 10 obviously is unvaccinated, but the next group is a little bit challenging because actually especially months ago, the 18, 19-year-olds are really driving that group really high, and they don't break it down any further than that. We've been kind of asking for that, and initially the numbers were so small that they didn't want to do that, but this is another good reason to ask for them to get more granular with the data. But I'll put the link in there so you can take a look at that. It's certainly, becoming a higher percentage of cases, but I'll let you look at the numbers.
Thank you, and we will, Charlene will lift the link and put it in the minutes as well.
Okay, so we can open it. Oh, sorry, Angela, go ahead.
I don't know if any of you guys can answer this question, but it's been on my mind since the start of the second round. Is when we were in the midst of the highest, like the peak of COVID last year, the CDC map didn't look as crazy red as it is right now. What is the difference, especially when you take like the state of Vermont, where we have 85% or more that are vaccinated? Why is the whole country like bright red compared to what it was last year when it was at its peak? Did the statistics change, or did the measurements change, or did anything change with the map? Anybody?
So you're asking, so I understand the question specifically, why are there so many peaks, so many other places throughout, compared to last year? I think Delta is certainly part of the reason, but also vaccination rates in Vermont. First of all, it's 85% of eligible people, so that eliminates, again, all the children and all that sort of thing. So there's, my guess is somewhere around 50% immunized through the state of Vermont. And again, that's a guess. It's not an accurate number, which we're going to try to get. I don't think it's terribly inaccurate either. But again, what we're seeing are with the hottest pockets of COVID and COVID transmission tend to be the lower immunized places. They just tend to be that way. Or where there is just less of this of taking it seriously, I suppose. Now, having said that, again, there are places where we're just seeing upsurges because of the ease of transmissibility because of COVID, and there's some breakthrough immunization going on, although those people are not getting hospitalized sick compared to unimmunized. I'm not sure if I answered your question completely, but yeah.
No, not really. It sounds like nobody really knows why it's like the whole country's red, whereas the peak of this last year was like you had spots of orange and spots of red. You didn't have the whole map just all red. And with all the immunizations that we've had across the country, you would think it wouldn't be worse than the max of last year, but
yeah. Well, again, the hospitalizations are almost all unimmunized. So if that's answering your question.
I mean, there's been articles written, for instance, if you look at Florida, Florida did not have a terrible vaccination rate. Right. They just sort of didn't do all the mitigation they should have otherwise. And they sort of went wild because it was Florida, people were still partying there. And that's part of it. That's sort of why we're saying the masks are so important. They didn't fail in rolling out vaccines. They failed on the mitigation.
Dr. Lefkoe?
Yeah, I think the state turns red when the infection level exceeds, I think it's 100 per 100,000 cases.
Yeah, I think so.
And that's why I think Vermont was orange yesterday. I don't know what it is today, but that's why the whole country is red.
Everything's red.
Any other questions from board members?
I think it's actually the virulence of the Delta as well as the age category that it's affecting now. So, because like Dr. Snyder suggested, those younger kids cannot get vaccinated. So you have the unvaccinated and then the younger kids along with the virulence. So that accounts for the difference.
I also think, Angela, it's everybody's back to work, whereas last year people were at home. Could be. Anyway, so I'm opening up to anybody at this point. So if anyone has a question, sure, go ahead.
If you don't mind identifying yourself for the minutes, it'd be great.
My name is Mary Ann Dillon. I put kids through these schools, and I have grandchildren in these schools, young grandchildren. Can either of the doctors name the scientific study that they have done over the masking?
So,
The scientific study.
so there are about 40 peer-reviewed articles on the benefit of masks.
I don't want peer-reviewed articles.
Oh, so you don't want to hear?
I don't want articles. I want scientific study. There was a study done in Germany with 25,000 children, and I have the results of what happened with that study and the effects of masks on them. We have never actually scientifically studied. We are assuming that masks work, or they at least reduce the rate of transmission. And the fact that the children are wearing cloth masks, let's face it, a virus goes through.
What do you mean by scientific studies? There are many different types of scientific studies. There are studies done in the laboratory. There are population studies that are done, and these are based on populations. There are about 40 peer-reviewed articles that I have that have been passed by scientific muster that show the effectiveness of masks. So it's not just one. And again, there's hundreds of years of experience with masks.
I know, I worked in an operating room for 42 years.
So I'm not sure that you find one that, and I'd have to see the peer review associated with it, but I think it's pretty well standard understanding at this point that, and again, that masks work.
Okay, masks work, we'll go there. My next question is, it's not mandated, it's a recommendation. It's a recommendation by the doctors, it's a recommendation by the state of Vermont, it is a recommendation by the CDC. Why is it taken out of the parents' hands as to whether or not to put a mask on their child?
Yes, I know part of it is our plan of care, so, but I'll let you. Duty of care.
Schools act in loco parentis. That is a role that schools have. And we have a duty of care to follow the best advice that is given to us. And given the number of medical organizations, as well as our own Department of Health, recommending it, that I can do no less than to bring that recommendation to the school board. To do any less than what is being recommended by the medical profession would put our district at a great level of liability should somebody get sick.
Has anybody ever been sued for not following recommendations?
Not in this district, because I followed the recommendations. I don't track that anywhere in the United States. That's not something I do.
It's never been, nobody has ever been sued.
I'm not sure if that's true or not true.
I can't claim it verbatim, but it is something I have come across in a lot of the research I have done.
Before you go on to your next question, I would like to just see if anybody else has other questions. Sure. Is that okay? Is there anyone online that has a question for the doctors? Yes, Sarah, okay?
Hi, thank you for giving us the opportunity to speak with you this evening with this panel of doctors. It's great. I first want to identify myself as I am Sarah Pelly, the town health officer in the town of Mendon, which doesn't give me much credibility at all because I am not a medical staff, but I have followed the pandemic closely as we try to protect our communities. And more importantly, I am a mother of an 8-year-old boy and a 5-year-old girl that does start kindergarten tomorrow morning, and she's very excited about it. I support the school district's requirement to wear masks, and I'm still concerned, though, about the social distancing requirement, and that we're doing everything possible to try to social distance as much as we can. Sorry about that, my other phone is ringing. And I can't shut it off. So the social distancing requirements, I'm seeing as schools open up, and not necessarily in our district yet, because it was just today, but that we're encouraging the teachers to set up classrooms as far closely distant as possible, and that we're empowering our principals and our nursing staff to go around and communicate with their co-workers, making suggestions on how they might be able to set up their rooms so that they're social distancing as much as possible. The other concern I have is the cafeterias opening back up and having children eat without wearing their masks, knowing that infection can happen within 15 minutes of being exposed to someone that is infectious, and that our lunch periods, they would be masked for a longer period of time, or about that, and a little bit longer. So I'm still concerned about that, and I wonder if the doctor panels could address their opinions on that. And then lastly, it's about taking advantage that we live in Vermont and we have wonderful campuses outside, and that we're taking advantage of holding classes outside as much as feasibly possible before the weather turns on us. We don't have a great opportunity once the weather turns to have ventilation in the classrooms. And I was wondering if the district had, or the doctors had, any insight for the district about air purifiers and whether those could be implemented in the classrooms. Those are my questions.
Thanks, Sarah.
Thanks.
For any of the doctors.
Anybody jot all those down?
I love it when kids are outside, so.
I can say walking through the schools today that.
These are
there were a lot.
practicality issues of the school, really all your questions are practicalities of the space. How do you practically keep a child in school and keep a community relatively safe?
I can add that from a planning perspective, our infectious disease specialists really feel most strongly about the unmasked eating, the cafeteria, as you had mentioned. So feeling like that, there's a big rumble going on over here, so sorry. So really feeling like, and this was something we conveyed to superintendents and the Principals Association early, that really we didn't feel like we had to, we didn't want to limit students being in school because of need for social distance in the classroom. We really felt like with masking and other stuff, we could minimize some of the risk there, but really the eating was key. And so I know some schools have been trying to really to do shifts around, and it really depends on some are still doing meals in the classroom. So we are recommending as a chapter that schools pay close attention to the times when kids are eating and their masks are down.
If I can comment on what we're doing, it varies a little bit by school, but in some schools, if we went to last year's social distancing, we would only have half the class in at a time. And we also would not be able to feed kids. Barstow School, for example, turned the cafeteria into a classroom in order to spread out. Otter Valley could only feed half the kids at a time. So we're doing but many of our schools, elementary schools anyway, are having older classes eat in the classroom and younger kids eat in the cafeteria so that we can spread out. So we are doing what we can with the goal of keeping schools open for all kids 5 days a week. And on top of that, we are doing seating charts, contact tracing, et cetera, so that if something does pop up, we can quickly act on it. It's not just, whatever happens, so that we can quickly jump on any potentially positive case and limit the transmission. But we can't do it all. We can't do the full social distancing that we did last year and have kids in school 5 days a week.
To her question about air purifiers, I just wondered, is that even recommended?
We are following, I don't have Steve here to talk about the technicalities.
Okay.
But we are following the recommendations. We have checked all of our ventilation systems. We have ordered some HEPA air purifiers that the state has offered us. We are following all the recommendations that the state has put out. Outside is better. I started to say earlier, as I traveled all the schools today, about half of each school seemed to be outside in a class as I went through.
Angela.
Well, maybe there'll be a new technology budget from the federal government to help put UV stuff into all of the ventilation systems, because supposedly the UV is killing this and kills a lot of viruses out in the world. So all these companies that are, really have been doing the UV lights for a long time are now starting to get really busy and people are starting to buy them because of this virus and the fact that it does help with the air. And I know my company is doing, they do healthy building inspections. So they'll go through it like once a quarter, and they'll go through and test all the air quality in the buildings and make sure everything's healthy and safe. I did have another question, but you'll have to come back because I forgot it already.
Okay. Anyone else that hasn't had a chance to speak have a question? I know you had additional questions. I just wanted to give everybody a chance.
Now I know why the school is run the way it is. Now I know why this town is run the way it is. This really says a lot. There's a school board meeting, and people just kick back and do what they're told. I do have one question.
Sure.
Is there an actual test? This is for a doctor. Is there a test that leaves out the Delta variant so that you know for a fact you have a Delta variant and not just COVID?
Dr. Bell might answer that. When we first heard about Delta, and we had a patient who was positive in our community who wanted to know if it was Delta. So it was sent up, that specimen was sent up to the UVM lab that identified whether it was or was not.
So are we doing that with everybody that gets COVID?
There's not like a rapid type of, is it one or the other? But I guess, again, it's an epidemiologic question, whether it's Delta or not Delta. We know epidemiologists are looking at the prevalent strains, as they do like with flu or anything else, So in specific labs, that's being done. As a matter of like a routine office test, that's not available.
So then how do we know that Delta is causing this spike?
Again, epidemiologically, they're looking.
So they're testing everybody that comes into the hospital.
You don't have to test everybody. It's like TV ratings. You don't go to every single house. You do samples.
Okay.
Right?
That was my question. Now I remember.
Okay.
You spiked it. Do we think we'll ever come out of this? Do we think this might be a new norm for the world, that like the flu, like we just need to figure out how to live in these new strains and this new environment forever? Or do you think the world will actually come up with a actual,
I think we might find, like
polio or whatever?
Dominating now, which actually I'd love for other people to speak.
You're doing such a great job.
I think that my colleagues and I believe that this is somewhat of a new reality, not mask wearing, but certainly COVID-19, now maybe COVID-21, next year COVID-22. Again, COVID, like, we're going to learn, humanity's going to learn to live with every virus we've ever had to learn to live with. And this is another one. We got out of smallpox by immunizing. We got out of measles, although we keep going back and forth, by immunizing, by reaching a certain herd immunity effect. And I think that's what really most of us are thinking COVID is going to be like. The future of immunizations, again, it's all speculation, but it just depends on the virus strains and the surveillance of those virus strains, and understand some of them are going to be less virulent than others. And it's just going to be another member of planet Earth that we're going to learn to live with.
Coronaviruses have always existed, primarily in the animals.
Yes.
You vaccinate your dogs for coronavirus, they vaccinate horses for coronavirus 17. We had all the way up till 17. We skipped 18, we hit 19. It became human strain somehow. We don't know how.
Yes,
I wish we did.
So coronavirus is a common cold virus.
Yes, it is.
We've known it forever, and what's the cure for the common cold? We never bothered with
Right.
trying to find the cure for the common cold, because most strains of coronavirus really don't bother us very much. This is different. This is clearly, this is just another planet. It just is.
And I do have
and that's where we're at.
one more question about the virus, the vaccination, the vaccine. Why has no other mRNA vaccine ever made it to market? It's been studied for 20, 30 years.
That might be for Dr. Bell or one of the others. I don't know why. You're correct. It's been studied for quite a while and quite effective.
It has never, ever
and
made it to market.
So I can't answer why. I don't know the
Okay.
answer to
And
that. But
now-
perhaps one of the others can.
Yeah, now we have one that's emergency
Yeah.
use only.
That's not true.
Well, it was.
Um,
Most things don't.
It
The
was
comma-
emergency use only.
And it was found to be effective, so it was able to be eliminated, and now it's no longer considered emergency use.
It still is.
Still, if you go into the statutes, it's still emergency for people who are at risk. You go in there, it's at the bottom.
And the one that they approved was Nick Cloud's it's got a different name.
Dr. Bell, do you have an answer for that, possibly?
Or Dr. Rubin,
Or-
or Dr. Myers.
Yeah.
So my understanding was that much of the research done on mRNA was also done for the original SARS-CoV-1. In other words, it was done that's why they had this ready to go. They just sort of tweaked it to meet this thing. They had been working on it. I think that SARS originally did not need it, but I think they would have rolled it out more if it had become more virulent. That's my understanding. I don't know also whether they were thinking of using it for Ebola. I don't know. I mean, I don't remember, Dr. Bell, I don't know if you know whether that technology was going to be used for that as well. But I mean, they had this sort of like on the plans to do, and they knew that they were going to need to use this if this thing developed, and this is so it wasn't like it was a failure on the drawing board, and they decided they had it ready to go, and they were working on it, and I believe it was from the original SARS.
Okay, and I read a couple of articles that have since disappeared, actually, off the FDA website and off of the CDC website in research, that...
Well, I'm inspired, but where are you getting your sources from?
Me? The FDA website, the CDC website, and when I looked into mRNA vaccines initially, there was a couple of articles that really didn't hold them in very good light for use in humans, and they have have since disappeared. I can't pull them up again for the life of me. But I was just curious as to what the thoughts are on why this one actually made it to market in such a, yeah, hasty way and with minimal actual clinical trials.
I do believe the research early on was not in human research. So what you're saying probably is she probably did see some articles that talked about how it is not being used in humans. I believe that's correct. I think the answer why it was done, I mean, the title was Operation Warp Speed, right? Donald Trump just did everything he could to make this happen as fast as possible, and you know, pushing every single organization to go ahead. And initially there was an emergency use status, and of course many different types came out. A number of them failed and fell apart. I think also at this point, so many hundreds of millions of these vaccines have been given at this point. So we see it's clearly the effectiveness, clearly the safety of it. And but why was it rushed faster than anything else? Because that was the agenda, I think, of every single medical and political, you know, I will not talk political.
That's a whole nother discussion.
Rewind that word. But really, I think that without a doubt, this is historic how quickly it did come out. And the vaccine hesitancy around it is just understandable. It just is understandable. But we do know, again, we're always looking at a risk versus benefit, you know? And the risk to so many people, there have been so many massive numbers of deaths over this virus that the benefits were just so worth it. And clearly that's panning out to be the case.
And what is the survival rate of the virus
without
comorbidities?
Well, we always look at we always look at morbidity. We always look at morbidities.
I get that.
For example, in pediatrics, the last thing in the universe we ever want to imagine is a mortality rate. We look at everything, and I'm a pediatrician.
I get that.
We care about morbidity. Well, we care about healthy.
Trust me, every single one of my kids has had every vaccine there was. In fact, even when HIB came out, I called my pediatrician, who had not heard of it. And her statement was, leave it to a nurse. And I hate to make this all just about, I really do.
Well, let me tell you, I was there when HIB came out too, and unfortunately we can only do it in 18-month-olds, and we needed it for 2-month-olds. And within 1 year of HIB, the worst meningitis a pediatric patient can have. And when you saw the graphs in 1 year, 2 years, it went from up here to gone to there. And it was a traditional type of vaccine. And I agree, an mRNA is definitely a different type of technology the technology's been around forever, but there's no question this is the first time that it has been used. And I'm not, you know, we're really digressing because this conversation is not supposed to be, certainly not about HIV, but, and really not even about immunization. But.
I'll let you all get on with the rest of it. I have opposition to masking children. They're missing their facial cues in learning. It is less likely to affect children, including the Delta, as far as, from what we've seen, there are no children in the state of Vermont right now, today, that are in the hospital with COVID or the Delta variant. I'm not saying that they aren't sick, but the studies that I have seen and have pictures of, most of them have minimal cold-like symptoms. I really wish that it was put in the parents' hands. I have supported this school, this town, and not this board, but all the ones before you. And I do not like things being taken out of a parent's hand and a parent's decision as to what is best for their child. When you have children with learning disabilities and they get a lot of it from visual cues, you're taking that away because all they're seeing is from here up. And I am concerned about the future of the children, including and especially my 2 grandchildren in this school system.
Well, ma'am, thanks for being here.
They're legitimate. one of her concerns are legitimate.
Yeah.
I think some of them are inaccurate, and I disagree with some of them.
Okay.
I think, first of all, like I said, every pediatrician has seen some very sick children with COVID.
I'm not saying
So,
that.
and you're right, many fare very well, but they are transmitting it to other people. So we are seeing that. Facial cues, yeah, we miss it, doctors miss it every single day. We all miss the facial cues. I don't think it's causing developmental delays. I think we can have a different argument about that the first year of life, the first 6 months of life, perhaps. And today I was shocked, and this is something I miss as a pediatrician when I have a newborn, a 2-month-old who just learned to smile, and I want to smile back at this child, and I'm wearing a mask, and nothing's happening, I think. You know, today actually, and it was funny because I was thinking about this just today with a patient. Sure enough, I'm wearing this mask, and I'm wishing I'm not wearing this mask because we all hate to wear masks. And this child, I'm smiling at this happy kid under a mask. He looks at me like he's picking up still. He's not getting all my facial cues, but he's getting, we have an awful lot of facial muscles.
I work with surgeons.
So, well, good. Well, there you go. Okay. So, my condolences. But I'll say, you know, developmentally, I don't think school-age children in general are going to miss out.
But we don't know.
Children with, it's a risk-benefit ratio. So, secondly, I think developmentally delayed children or children with special needs, if there's some sort of reasonable accommodations that can be balanced out, it's a worthy discussion to have. It is. But we're looking at, you know, again, there is no perfect in my mind. This really stinks. We all know it. But we're trying to do the best, I think, at least, and now I'm just talking from my practice, where masks are mandated in my practice. You know, we wear PPE, as it is throughout my whole organization. At times it was just in clinical areas, but now because of spikes, and we do know that the majority of this is Delta, again, because that's just sampling. You don't have to test every single person to understand. That's the predominant virus that's circulating. It doesn't stop at Vermont's border. That's the predominant virus that's here right now. And that's going to change.
I've done my own mask study
Yeah.
for the last year, including a trip to Sturgis during the motorcycle rally.
Yes.
I have not put a mask on except when I've had to go into my doctor's office. I didn't wear it in the grocery store.
Sarah Tolley is asking to ask a question
Okay.
So
or make a comment.
I'm healthy.
Sarah?
Oh, I just wanted to represent the parent of a child that's actually in a school right now. And that, you know, the district can't make both sides of the debate here happy, because I'm on the other side of the debate where I want to keep my child in school and learning. And if wearing a mask was going to do it, and she's been wearing a mask for 1.5 years now and doesn't have a problem with it. She was 3 years old when she started wearing a mask. She's now 5, and she is raring to go to school tomorrow. Last year, we made the decision to pull the child from Barstow in November as cases rose, because I didn't want her exposed to COVID. Now we're facing, we have the same level of transmission as last October, or as last November, but I'm choosing to send her to school because it's what's in her best interest. You know, so I mean, parents still have the power. They can choose to send their children to school with a mask to the benefit of them all, or they can choose to keep them home, just like I did last year. So we are still empowered, and I commend the Rutland Northeast Supervisory Union for, one, putting out the survey asking parents what they were comfortable with before school started, and now implementing every safety strategy that they can be advised of to keep the children safe. So kudos to the school district.
Can I answer that?
No. Kevin?
Yeah, I just wanted to thank people online and you, ma'am, for being here. We're inexpert. We have to take the advice of other people on this. And it's, and even as both the first two doctors that spoke acknowledged, that we're learning all the time and things can change. So I would say to you, don't be afraid to hold our feet to the fire. If in a month or two the indications are that that things are different, and, none of us, I'm assuming, like masks. Everyone wants to be back to a pre-COVID normal as soon as possible. And we're certainly willing to take, at least I know I am, to take in new information and revisit these decisions as time passes forward. So you're probably not going to get what you're looking for from us tonight. But that doesn't mean that we're inflexible or that we're not listening to you.
Go ahead.
Hi, my name is Lexi Doobie. I have children in Neshabie. I have a preschooler starting next week. I just want to give you some food for thought. These kids were running around all summer long without masks. And they were fine. Indoors, outdoors, summer programs in the schools, and we did not see any outbreaks in our area.
And neither one of us are saying no masks anywhere.
Right.
If you want to send your kid to school with a mask, by all means.
To say if our kid doesn't want to wear a mask, or we feel like it's not in their best interest despite what everyone else says, we just want the option. I went through those 320 thought shares, and of the majority, parents just wanted the option to mask. There were a handful who were, I want all the staff that vaccinated and masked. And then there was plenty that said, just give people the option. No one's saying your kid cannot wear a mask, but don't tell me that I have to send mine in one.
Okay.
That's all I'm going to say.
All right. Thank you.
Thank you.
Okay.
Thank you for listening to us and putting up with us.
Yep. Anytime. Thanks for coming.
Thank you very much.
Thank you.
Yes, so I will say thank you to the doctors for coming very much, and thank you for all of the parents and everyone else who came to listen to that. You're welcome to stay for the continuation of our meeting. However, you'll probably all have better things to do. So,
I also really want to thank the doctors. We had just put out a request, and Dr. Bell immediately stood up, and then I got an email yesterday saying that the rest of you local pediatricians were willing to be here, and you put in long, hard days. So speaking for the kids in the district, we really appreciate your time, all of you. Thank you.
Yep.
Thank
you
you.
very much.
Thank you.
Thanks so much. Okay, so moving on, consent agenda. I need a motion. Okay. Second?
Sure.
Yeah, Kevin made the motion. And I think, Barbara, did you make the second?
Sure, well, we can split it.
Okay. All right, all those that approve the consent agenda, please signify by saying aye.
Aye.
All those opposed? Consent agenda passes.
I thought people were waving. They were raising their hand, and I waved back.
I wasn't even. You guys didn't.
We didn't worry about you on that.
Funny.
Sorry.
All right.
You have no vote.
So moving on, because I know we're late, but I thought it was important that everybody get to say what they needed to say. Monitoring report 2.8, communication and board support. It is in your packet. This is one we have seen prior. I don't know. There may be some new board members who have not seen a monitoring report that Jean has compiled. I don't remember exactly what page it was in the packet, but anyway,
I didn't write that down either.
I think it's 36 or something like that.
No, it's not. It's closer.
It's earlier than that.
Oh, all right. Well, anyway,
Very small packet tonight.
it was actually. Where's Bill when we have a small packet? Anyway, the monitoring report, if you look at it, you will see that in yellow is the changes that she made from the prior year. So those are the updates. Everything else looks like it has remained the same.
For the, those are the updates for the interpretation.
Okay.
I would have gone through and updated the evidence pieces. I did not highlight those.
Okay.
But they are for the current timeline as opposed to the previous timeline. I can also tell you, and you'll get a more thorough report on this, but when I gave you the evidence on the IRS piece, we actually just recently got word from the IRS, the 2018 delay in submitting our information was, we actually ended up getting a rebate for that year. We ended up getting some money back because it was found to be fine. But they did just notice, which I identified for you, that 2019 now has to be looked at because we weren't told until after the 2019 timeline. So we knew that 18 and 19 both had an issue. 18's been cleared, 19 is now under a review.
Okay. Questions for Jean in regards to her report? Anybody online? No? Okay. I would entertain a motion to accept.
So moved.
Second.
Angela and Eric. Okay, all those that approve the 2.8 monitoring report signify by saying aye.
Aye.
And everybody online? Excellent, thank
I'm
you.
not supposed to wave.
I know, right? Okay,
Got it.
thank you. All right, so our next piece is the board monitoring report 3.1, unity of control. That was the very next thing in your packet, maybe not, I don't remember. It's a one-page document. There's only two things. That we have never looked at this one before. We actually haven't looked at any of our policy 3 point anything. So this one is unity of control. And what I would like to ask any of you who may have looked at this earlier is that as far as the policy wordings are concerned, is this something that we even do? Is it something that we need to change to be something that we do? So only officially passed motions of the board are binding on the superintendent, meaning that we can't make Jean do anything unless we've actually passed a motion.
Or at least given me consensus on the part of the full board.
Exactly.
In other words, it's not just one request.
Right.
And I think your board does that. I mean, I don't have an issue with somebody sending me off on a wild goose chase that hasn't gone through board discussion.
Right.
So Lori, I'm not understanding, are you asking whether we need to change 3.1?
So what I'm asking is that what's here, does that work for our board? If it doesn't, should we change it in some way?
Do you have common understanding?
And, right, and then do we have common understanding also, which, because if there's two sections, it says, what does this mean? What's our reasonable interpretation? And then examples of when we haven't done this.
So my question is, I'm sure there's times that you come up with stuff throughout the year as a chair that you do run with without having the full board meeting.
Never. Never.
I don't believe it.
I can't think of anything in the,
like investigations,
No,
or
I don't hear any
bringing
of that stuff.
policies or doing stuff like that. There's got to be stuff that's happening
The only
behind the
so
scenes.
things that
Oh,
she
I'm
might
just
talk
saying,
to me
'cause
about.
You guys have a
What do you
relationship.
mean my 3 a.m. phone
Yeah,
call?
right. I get notice that
I'm
she's
not
getting
saying-
married first. I
Yes,
think that's a
how
chair
did that
thing.
happen? No,
She did
No.
get notice of
I
that.
did get notice of that.
I actually got noticed too.
Some things that I get noticed of is if they're like so Jean notified me today that everything went well at school as far as, first day, nobody came, spraying bullets at the place because we were masking or anything like that. So I did get those kinds of notices, but I don't ever as far as policy is concerned, she might ask me a question, but I always say, well, let's throw it to them and see what they say, because we are a board. It's not just me.
Right, I just want to make sure that if there's any instances where you feel that as a board, as a chair to the superintendent, if we should open this up just a little bit, that we should at least talk about it.
Oh, well, so
If there's any instances, but if it's not, then I'm happy to keep it this closed.
I don't think so, because usually we talk about it, like, if there's something that needs to be signed after we've approved it, you usually give me power to sign it. That would be something that maybe this would fall into. That kind of thing. But realistically, we don't make any decisions without your guys' input. I just
It's
can't
not,
think of
it's
any.
not so much decision, it says or instructions.
Oh, no, I don't.
It's not just,
I don't instruct
you know what
her
I mean?
either.
It's not like a defined,
Angela,
like
is
you're
your
making-
question to Lori,
sorry.
asking her, do we need to amend this so that she can? Is that your question?
well, yeah, that's what I'm saying. Is there any instances that it's, holding her, the two of you's work, is it holding you back?
Oh.
Or does it happen somehow and it could be so insignificant, but it would fall under this
True.
stringent
The only thing I can
guideline.
think of is, in the agenda meetings, which, anybody's welcome to join, I suppose.
You're making
It might
decisions
be
in
a,
there.
how do we order this agenda type discussion that I really turn to Lori and say, well, you're running, but then there's another whole policy on agenda planning. you're running this meeting, what order do you want this in?
And what you're putting in it, you're making those decisions.
Well, actually, so this is the first year that we did the work plan at our retreat, so there
Yeah.
really is nothing going into the agenda anymore unless you guys request it to me directly and I add it to the agenda, or that it's, because it's on the work plan.
Or unless it's something
Or
that
it's
really
something that
cropped
comes
up
out,
because
right.
something happened in a school that needs to come here.
Or like you said, you wanted someone to talk to us about something and we couldn't give you a specific date and we find we have one, then we'll throw it on the agenda, but it's because you've asked
We've
for
already
it.
asked for it.
Right. Okay.
I think
Yeah.
a possible implication, like for number 2, would be I was thinking of a committee, like Hawk Hill is a committee,
Mhm.
and if we were to, take some idea and run with it and try and do our own thing, like the boardwalk project, out over the Beaver Pond area or something like that, which is a big deal. If we would just say we're gonna do that, which would take a lot of money and a lot of organizational time out of the office, blah, 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 we're not doing that. So I don't think we're out of line.
Yeah, I think Brenda or I would speak up if that were the case. So
Right. I mean,
when
you've
Hawk
got
Hill
places-
wants to apply for a grant, that's nothing. We say fine, and ultimately, if you got it, the full board would. But if there were something, Brenda's really good about if she's being asked to do something that takes her away from the other work she has to do,
Right.
she'll bring it to me and say, is this something the board needs to approve? Because that's really going to redirect her workflow.
I mean, we did ask assistance for the committee to do some organizational work
is
and
fine.
put together binders and get together a lot of documentation and things like that. And that was very agreeable to support the committee. But potentially they could have said, that's too much right now. We're in the midst of all kinds of other stuff, so we're not gonna.
Sure, but that's
take that
also a
on.
one-time thing too, right? I mean, now you kind of feel like you're organized and now
Yeah.
you're just doing a little bit at a time.
Yeah.
So this would be something that, like, if we went to Jean and said, okay, we want to know.
If one of you went to me.
Okay,
Right.
fine.
Right.
If
If
I
one-
went
one
to
or
Jean and said I wanted to know where every single senior went to college and what their grade point average was and why we think that it wasn't higher, or, something like that, that's where she should nix that in the butt.
Yeah.
And tell me, because that's when I'd have to have a discussion with myself and say, hey, not cool. So.
Lori, I think that the way we operate really meets the intent of this.
Yeah.
And I think it's been effective. So
Okay.
I'm not feeling a need to modify anything. I think that we all understand the intent.
Okay.
And I think that the way we conduct ourselves is such that we try and meet the intent.
From my perspective, I would agree.
Yeah.
I agree I think that's Barry. I agree with him.
Okay.
But it does say in 2, it says the superintendent can refuse. The superintendent shall refuse. It shouldn't be a can. It should be a definite, like, you should not do it ever, right?
Would that apply to the Hawk Hill example we just had?
No, the Hawk Hill is a designated committee of the board.
But if Hawk Hill's,
It
if
says
Hawk
in the case
Hill's,
of board members or committees requesting information, change the superintendent shall refuse, then that means Hawk Hill has to come back to the board at the next meeting and say, please force the superintendent to help us. I think it takes away a certain amount of discretion on the part of the superintendent.
well, I think if you're spending money for any special committees, or if you're changing the intent of whatever special committee that's going on, or you're, like, any of that should be coming back to the board anyways. If they're doing something on Hawk Hill and they want to change the landscape over there for some reason, it's our land. We should be actually voting on that.
Well, it should come back to us by, our committee member or whatever thing. And maybe that, that's something that, like, if you're at the Hawk Hill committee and something happens and you're like, oh, I should tell the board, we should put something on, we probably should have a Hawk Hill something or other on the agenda every once in a while to find out what you guys are doing, what you're planning,
It's a good idea. It's not on your work plan. It's a
So,
good idea.
right.
Yeah, it
So we
definitely
probably
be.
should have something like that.
I'm, I have to confess that I am out of compliance with
With the rule we just made?
Submitting an annual report to the board.
Whoops, uh-oh, whoops. Now you're saying we're out of.
We look
no.
forward to your 90-page report.
So we are having a committee meeting next month.
Okay.
And after that time, I will craft.
So maybe in November?
Craft an annual report.
Well, the agenda is here somewhere, I have it. Huh,
The work
look at
plan.
that, yeah, the work plan. I'm seeing what we have on our agenda for November. Minutes, we're having an Momentum report. But I think I think we can put it on the November 3rd meeting, if you're okay. And then if for some reason we don't get to it, we'll just push it to December, okay?
Or if you don't.
Or if you're not ready.
Either one.
We'll just take it off. So, okay. All right, so what I'm putting on here, in the course of number 2 under what does this mean? I'm just saying Hawk Hill and negotiations are only 2 committees. They can request info, but if it's too much for the superintendent, she can nix it. Or come back to the board for more, clarity. Correct?
Yeah.
And then number 1, what does it mean? So it just essentially means that no one, board member, can boss Jean around. All right, and examples of where we did or didn't do it? We have any off the top of our heads?
This is actually more applicable to 2, but
Okay.
I was involved informally in the planning for the heavy equipment course.
Oh. Mhm.
And we reached a point where Brenda said Kevin needs authorization to continue. He's got to be out of the loop until he gets authorization from the board, which I think is, appropriate. And I don't want to do it at this meeting, but I think at a future meeting, I want to get on the agenda and discuss setting up a committee for that or requesting
sure.
individual authorization for that. But I think the system worked in that case, that, it probably needs to go to the board, and it was time, and so I basically agree with what Barry said. I think we've got a working system right now where the administrators are willing to say, oh yeah, we have time for that, we'll help you out, we'll get that report together for you, the committee, or the information, or another time saying, well, it seems like it's maybe time to have a board discussion about this. So, again, agreeing with Barry, I don't see any particular need to try to modify the language.
Okay, perfect, thank you. Everybody feel good about it?
Yeah,
I agree.
Okay, awesome. Then we are going to move on. Okay, governance process, PG policies for action. These are our second readings tonight. The first one is policy 2.9 equity. I need a motion.
Motion to do a second reading or motion to discuss?
Motion to adopt.
Motion to adopt.
Or, well, it can be any motion, but I assume it's to adopt.
move we adopt policy 2.9.
Okay,
I'll second.
thank you. Okay, discussion.
So I want to ask if anybody's read the Mid-Atlantic Equity Commission's equity audit.
No, I wrote it down, but never got to it.
Mid-Atlantic?
Yep.
Who's that?
Who we have contracted
Oh,
with.
yes, I did read that.
Okay, well, I would suggest if you haven't read it,
I did read that.
it's probably irresponsible to vote on this at this time.
I don't get to vote.
I read it, it's 35 pages long, it's quite detailed. And it's written as a kind of one-size-fits-all document. Really, I would say for major urban school systems, there's lots of talk about English language learners. There's lots of talk about different, multiple ethnic groups in it. And it has extensive requirements for the school system. I mean, the first thing to say about it is that we're going to flunk this assessment immediately because of the complexity. And that means they're going to come back to us with a recommendation that's going to create a much more bureaucratic and frankly, I think more restrictive school system. And let me give you a couple of examples of that. I'll try to do this quickly. They define diversity as areas related to race, ethnicity, socioeconomic status, national origin, English learner status, sex, gender identity, gender expression, sexual orientation, religion, and disability status. It's a lot of ground to cover, and it's so right away we don't have policies on all of those things. They're gonna recommend a thorough revamp, and they're going to recommend more bureaucracy. This is under the section for school organization. Number 3, are there personnel or an advisory committee that coordinates school improvement and assures equity compliance in all phases of school management. That means that they're going to recommend that there be a committee established in our district to oversee what they call equity compliance, which means that teachers are going to be a lot more restricted in what they're allowed to do, possibly. And there's going to be a lot more intervention in things like curriculum, what kind of pictures you have on the wall in your classroom, things like that. And we have to be prepared for that. Here's number 8.
Can I respond to number 3 there?
Sure.
Go
ahead.
It says, the question is, are there personnel or an advisory committee that coordinates school improvement, blah, blah, blah. We have personnel that do that. We don't need a committee.
And an equity committee.
We have an equity committee already in place.
We have a
We have those
diversity coach,
things.
and we have a diversity coach, correct? Or
An equity engagement coach,
Equity
and then we
engagement.
have federally mandated policies that speak to those categories.
Can I ask a question?
When I read that, it didn't seem to me that we were going to be creating things out of whole cloth. It seemed like we're already doing a lot of those things, and yes, their capacity is to assess large urban schools and all the complexities that they deal with, and we are much smaller and also much more manageable in terms of doing those things. And and I think that we have many of those things somewhat in place. There's a framework there, and maybe some of the details we need to look at and polish some things or work on some things. But I think some of our stuff is in good shape, related to that.
Did you want to continue?
Yeah.
I'm sorry.
Yeah, no, I'm not. That's perfect. So 8 is data regularly collected, disaggregated, and analyzed in the following areas, and by different racial, ethnic, and language groups. And then they have a long list: course level enrollment, grade point average, achievement scores, standardized test scores, student discipline suspensions and expulsions, bullying or harassment, participation in school activities and honors, attendance. And then question 9, which immediately follows that, had an additional list of, I didn't copy that one, but an additional list of all these things to keep track of. And then they have questions about faculty and staff that we're going to flunk. Are staff members of different races, ethnicities, languages, national origins, sexes, gender identities, gender expressions, and sexual orientations? Same question for faculty, same question for administration. And then under standards and curriculum development, the recommended textbooks and other instructional materials reflect as much as possible the experience and perspectives of diversity among racial, ethnic, social, and economic, national origin, language, sexual and gender identity and expression, religious, sexual orientation, or disability status groups. So, I mean, again, that's getting us into the swamp of dictating to teachers, you don't have enough books about gender identity and expression in your classroom, for example. Question 15 is the same thing regarding curriculum. So what we're doing is setting up a system in which there's micromanaging of what goes on in the classroom and what goes on with different teachers. I think that's a bad thing in general, and I think that's a limitation on teachers' ability to individualize how they teach, and I think it's a limitation on the freedom in the classroom. That's got serious problems. And let me give you an example of where this leads. A couple of examples of where this leads. At the University of Pennsylvania in 2016, they took down Shakespeare's portrait. It's famous because it was so absurd. And the reason they took it down is not because Shakespeare's out of date, or Shakespeare's considered to be bad, or Shakespeare's famously racist or something. The reason they took it down is just because Shakespeare, because of virtue of being a white male, was considered a symbol of patriarchy and imperialism. Similarly, at Harvard Medical School, they've been taking down portraits of white doctors on the walls. These guys dedicated their lives to, eradicating disease or studying new techniques for surgery, things like that. And they're not being removed because they were eugenicists or because they were famous racists or anything like that. It's just the idea is that there are too many white faces on the wall, and we have to take them down. So that sort of reduction of people to their skin color, to their gender, as opposed to what their achievements were, I think is a very, very serious thing. If we have a portrait of Albert Einstein on the wall, is the Albert Einstein the greatest physicist of the 20th century and possibly ever, or is the Albert Einstein white, cis, male, heterosexual? And I do think that this type of mentality leads one to the second type of conclusion, that, we've got Albert Einstein represents all of these things except achievement in physics. So I want to warn you about that because it's coming.
I think it's worthy to warn about that. If it starts to go that way, then I don't think we should respond in that fashion. But if you're talking about taking down Shakespeare or some of those others because there's too many whites, then put up a picture of Stephen Hawking because of the disability issue. Put up some other. There's a whole lot of other issues here besides race. And
oh, sure.
And absolutely. We need to look at what's the balance that we're talking about. What's the balance that we're promoting?
Yeah, I would say that
we don't want to be, we don't want to skew it. And I think an audit would ask those questions. Are we presenting something that's on the face skewed versus balanced?
Skewed and balanced in what way? That's my question. Because already I think you're getting into that trap. I think it is a trap of saying he represents the abled physicist and Stephen Hawking represents the disabled. I just think that's a really bad way to go. I think you wind up with Lebanon when you have those sorts of assumptions that, the prime minister has to be a Sunni, and the president has to be a Shiite, and the secretary of education has to be Druze. That type of mentality, I think, is a very dangerous one for America.
Yeah.
Got two more brief points, Lori.
Okay.
One is that we've been down this road before.
I don't know what you're looking at. I just would like to
Yeah,
know
can
what
you
you're
just
looking
direct
at.
us to what you're looking,
I'm
because at the
lost.
link, we can't find it.
Oh, you have to search for it.
I also have a
Is
point
this
of order
something we
here.
were sent? Is this a document we were supposed to have read for this meeting? Because I'm
No,
lost.
At a previous meeting, I told you that we're going to use Mid-Atlantic Equity Consortium.
That I found that email,
It
yeah.
was- And I gave you a link in that. That's
And then you have to search
That leads me
within
to the
that
website.
Or I'm a little
Okay.
confused on process.
What is the document we're, I'm just not clear.
Let's answer her question
We don't
first.
have a
It's called-
document. They have not done an audit. He's reading their template on what an
Yeah.
audit looks like.
They call it the MAEC equity audit.
Okay, that
All right, so, but we need to go to Barry, who said point of order.
Yes, because I feel as though, Kevin, I understand your apprehension around what the possible outcomes of the audit may lead to. I do, I totally do. Been through a lot of audits, and they're deep. But what's on the table is a motion to adopt. And I think if adopted, this policy alone is what we're really required to be compliant with. right? We adopt a policy and we're required to be compliant with that policy.
We can change the audit format.
The information that comes out of an audit is going to provide recommendations.
Okay, well, I'm at the point of making general remarks now anyway.
Okay, but I think we're talking two separate things at this point, and then until there's actually a policy that's adopted, we're not required to be compliant with anything.
Right.
But once adopted, we can take those recommendations and then determine as a board, is there anything within our already existing policy we want to modify based on those recommendations? But I would not fear to adopt a policy at this point based on the anticipation of the outcome of an audit.
And this policy has no mention of mid-Atlantic or anything.
Absolutely right. All right, so the last couple of points I want to make is we've been down this road, and I want to give the example of, in the United States, we've been down this road regarding religion. University of Vermont in 1800 made a big deal, big difference whether you're a Congregationalist or a Unitarian. We don't care about that stuff anymore because we didn't codify that sort of thing. University of Vermont in the 1930s it was a big deal. In fact, it was almost impossible to be a Jew at the University of Vermont in the 1930s. They were following Harvard's example. Harvard changed its admissions policies to eliminate Jews in the 1920s. It was very difficult to be a Catholic at the University of Vermont in the 1930s. If the University of Vermont or all these other places had decided at that time that we're going to have, say, quotas for Jews, they're about 3% of the American population, they'd be considered vastly overrepresented today. So I think going down a path where you say these things don't matter is a better historical example for Americans. And then the last thing I want to say is that this is rampant through this audit, which I guess we're not talking about at the moment, but through this mentality that there's a confusion of culture with race, that, and this never hurts white people. It's only something that affects minorities. For those of us at this table, anything we become interested in for the rest of our lives, no matter how obscure an obsession it is, no one's going to say, you're white, you're not allowed to think about this, you're not allowed to be interested in this. But this happens with minorities all the time, that you can't be black and be interested in knights and castles because somehow this is inappropriate for your culture. That's a terrible burden to put on people. It's this confusion of culture with race is really dangerous, and it's very fashionable in America right now, and I don't think we should participate in it. So for all of these reasons, I'm going to vote against this. I know I'm going to lose, but I want to get this on the record that that there are many problems, and really the basis of it is the mentality that leads to this sort of examination. And Barry, I don't think that when the time comes, we're going to pick this audit apart. I might try to, but I think everybody else is going to say, well, come on, Kevin, these people are professionals, what are you doing?
No, I think we should pick it apart, and I think they will come in the form of recommendations, and we should evaluate them.
Okay, well, maybe I'm a little skeptical from my experience last year, but we'll see. Anyway, so I recommend a vote of no on this second reading. Thanks.
Brenda, you had your hand up. I mean, Barbara.
I did?
Sorry.
You
had wanted to.
No, that was about.
It was
Fred.
just, I didn't know what he was, I didn't know
So
what
is there
Kevin
any
was
other
reading.
discussion regarding the second reading? No? All those in favor of policy 2.9 equity, please signify by saying aye or raising your hand if you're on camera.
Aye.
Aye.
All those opposed?
Hey.
Okay. The ayes have it. Policy 2.9 passes. Policy 4.4, the chair's role. We had an addition of 4.4 to F. It is in your packet.
Or can I make a comment on that 2F?
Sure.
I think, I understand the intent and I 100% support it. But my comment is, let me get to it. Somewhere in there it said with respect to policies, and I really think it should be with respect to agenda items. Because a lot of, I mean, I would expect the chair to perform these duties with regard to any of our discussions or conversations, hence agenda items, not just policies.
Barry, can you tell us what page you're on?
No, I lost it. I had it, and I lost it. so.
It's
I
right,
can tell you.
it's the, right under the,
23. It's at the same page as the equity policy.
Can
It's
we
one-
get a motion first? I forgot
Oh,
about
I'm
that.
sorry, I'm sorry.
It's one
That's all right.
tiny section on the bottom of page 23.
So I do need a motion.
What would you like the motion to be?
Well, just make the motion and then you can make your change if
Are
that's.
you adopting
or-
it?
I'd like to make the motion to adopt
With a change, and you.
with
can-
the
you're-
change, policy 4.4 chair's role.
Okay,
And I did find it, thank you.
I found it too, thank you.
And my only, like I said, my only point was just to expand it and not have it be just restricted to policy issues.
so what do you want it to say?
Policy and agenda?
I think agenda items or topics are,
So addressing agenda items or policy and agenda items?
sure. I think that any conversation we have or discussion we have is really under an agenda item.
Okay.
But I just wanted to broaden it, that's all I'm really saying. And not just policy issues.
Addressing-
I'll second Barry's motion.
What was,
Yeah.
what was the change though before Barry's change? Like, what was it going from?
It's something that, no, it's something that we added at the bottom because it's an addition to the whole policy because there has been.
This is why we gave you the whole policy.
Right, no, but it's an addition to what was already there,
Okay.
to make sure that public and
added
board
that.
behavior is, is limited to what we're supposed to be talking about.
We added 442 then.
Yes.
So, wait, just to clarify, so you're suggesting that anything that the chair is assuring the public and board behavior is limited to what's on the agenda as opposed to what is in policy? Is that what you're?
I'm expanding it to include agenda items.
Policy issues and agenda items,
Right.
I think is what he wants to say.
Right.
I would put it the other way, agenda items.
Agenda and policy.
Either way.
Okay,
Yeah.
either way.
Yeah.
Okay, someone second, Barry's, Kevin did, thank you. Any other discussion? All those in favor of the motion as Barry stated, please signify by saying aye.
Aye.
All those opposed?
I'm gonna say nay.
Okay. All right, well, the ayes have it. All right, sale of land to Agency of Transportation for Route 7 improvements. So, you got a whole bunch of stuff in your packet from Brenda regarding this. We talked about it at our last meeting. But before we can talk about it, can someone make this motion that's stated here on the agenda? Says the motion to approve the option agreement with the state of Vermont for the conveyance by quitclaim deed of plus or minus 2 acres of land and temporary and permanent easements needed for the proposed US Route 7 widening project from and along the easterly boundary of the Otter Valley Union High School property southerly of the property's access driveways in exchange for $6,750, subject to voter approval at the 2022 OVUHS annual meeting, and to authorize the board chair to sign the option agreement and any other documents related to the transaction.
So moved.
Second.
Okay?
Eric had it
Discussion.
memorized.
You got it right here.
Discussion? This was negotiated by a lawyer, correct?
And
On
it-
our behalf.
And it's inevitable anyways, but they're gonna
Yeah.
they're gonna take it, so.
No, they don't have to pay. I mean, they could just take it, so.
what they're offered.
Yeah.
And it is subject to approval
By the voters.
by the voters.
Right. At the annual meeting though, so we could have 3 people there.
Right, so.
Oh, that's at the annual
I
meeting?
think
Yeah.
it goes on the
I think it would go on the
'cause
ballot.
annual meeting recesses to the
Yeah.
ballot.
Yeah.
Oh,
recess
okay,
to
well
the-
then it starts there.
Yeah.
So.
Did we get any assurances about
I have a
land
quick question.
Yeah, go
Since-
ahead, Natalie.
Since I wasn't here at the last meeting, I'm just curious. I assume that it's 2 acres, is that correct?
Plus or minus, yep.
And it was assessed, and the value, they found the value to be around $6,750 or whatever. we're selling it for.
That's what the lawyer negotiated for us. Yes.
So they negotiated that fee.
We negotiated it up.
We
from-
negotiated up.
Yeah,
From 4,000.
it was originally 4.
Yeah, the state offered 4.
I just feel like taxpayers are going to wonder why it seems so low.
It's not land that's useful. If you
It's
look at-
undeveloped, right?
Yes.
Which I understand.
And undeveloped.
In our current market, I mean, you could sell a half acre of land for $50,000 right now.
It's not a sitting half acre. It's along the side of the road type. It's not something that's, it's not like it's a sitting half acre. They're
It's a
cutting
half
into-
acre or 2 acres? That's what I'm wondering.
No, it's 2 acres, but it's along the side of a road, so it's a long, thin stretch.
It's just a strip beside
It's just
the
a
road.
widening. of the
Yeah.
road.
And the state of Vermont will, they only wanted to pay 4. The fact that the lawyer got them to $67.50, and then we're gonna pay the lawyer, we're probably still gonna end up with 4. So,
But we got other things too. I mean, like potential future, if you use the south end there, we got an entryway,
We got 6 trees.
right, we still have an access
We got
point,
trees to
right?
Got some trees,
Yeah.
we got it prettied up,
And we don't have to do it, so,
and you're right, it's inevitable.
yeah.
And they're gonna take it anyways, either way.
That
Becky,
was gonna be my question, is they're gonna take it anyway, so we might as well do it while we get the money, but if the voters don't approve it, they're still gonna take it, right?
pretty much.
Yep.
So we would want to make that point to the voters.
Yep.
There was a question started over here. Kevin, Derek? Hello.
Okay. Any other discussion in regards to this matter? Okay, all of those that approve the motion signify by saying aye.
Aye.
Thank you. Okay. Annual Workboard Plan Review, we're pretty close on time. We are gonna add the Hawk Hill Committee.
Oh.
What?
Sorry.
No, that's all right. We are gonna add the Hawk Hill Committee to the work plan. Is there anything else that we need to look at?
Yeah, I mean, I don't know if this is the appropriate place to add this or talk about this, but I would like to discuss career in tech ed, or, I'm not even sure about the phrasing, but that's the general idea, career in tech ed, internships.
So that's actually, it's not plugged in here, but you did request that, ELOs, what the high
Yeah.
school
Yeah.
alternatives. I have not yet had a chance to have Jim help me
Plug
plug
a date.
it in.
Okay.
But it is coming.
Yes, and
Yeah.
you'll see it in the minutes from
Yeah,
last
it's
meeting.
just, I don't know if obsession is the right word, but it's something that I feel very strongly about, that the board could be more active in and be more effective about.
It's necessary.
On that topic, we did mention, I think Angelo or somebody brought up Stafford and not really being familiar with what Stafford had to offer.
And Hannaford Career Center.
Yeah,
Well,
and I've been
that's all-
on the advisory board for Stafford for 4 years now, along with Marcia, who's been there much longer than that. And that advisory board is more or less a business board, kind of oversee funding and staffing and things of that nature. But there's people there at these meetings that there's an outreach person at Stafford who I'm sure if Marcia or I talk to Melissa Connor, she'd be happy to have her come here and kind of share with you, program offerings and things of that nature.
That was, actually, I think what came out in August was that we wanted to have a meeting, one of our meetings, presentations about ELO, Stafford, Hanford, all that stuff, early college.
Non-traditional
Right,
options.
non-traditional ways of having schooling.
Gary, I'm concerned we have a school population that some kids don't have their act together well enough to plan for Stafford and Hanford, and those are the kids I'm particularly.
Yeah, for sure.
Right, and that's
Yeah.
where an ELO would come in handy. So yes,
So
something like our big dig, yes?
I love that, the board is wanting to be updated on all this, but my main goal of bringing all this up and wanting the light to be shown on, and I think this is where you're getting at too, Kevin, is that it needs to be more than just the board. It needs to be the student body. It needs to be everybody. It needs to be able to see what is offered here at the school. And I really, really feel that it is not highlighted, and it hasn't been highlighted in the 15 years that I've been on this board. So just because they're coming into here, it's not going to end that discussion with me, because I'll be back in here with the parents saying it from the other side of the table, saying, get it out there, get it so people can see. And if Otter Valley is really, if they feel like it's gonna open up a can of worms, or it's gonna open up things that they don't want kids to go to, then start doing it in-house. Start making things available in-house.
I don't have a sense that that would be the case, Angela, I really don't. And like I say, they have an outreach
Fire,
group there
thank you.
whose sole purpose is really to go out and share that with people.
Oh, no, I'm not talking about Stafford. I'm talking
Okay,
I'm talking about Otter Valley.
Okay.
I'm talking about Otter Valley. Derek being threatened.
Something that was helpful to me, and it's tangential, but it's related, was when I was candidating for this board position, I asked Jean to introduce me, or I made appointments with all of the principals to visit each of the constituent schools, including Stafford. And it was really valuable to have an understanding. I walked through the schools, they give you, I got a tour. And Stafford was fabulous, and walked me through the various programs and talked about Otter Valley's, role or participation in their programs and stuff. Really good. I would recommend that be part of an expectation for
incoming freshmen or
candidates, or an orientation activity for new board members to make sure that,
Thanks for
And
doing
as-
that, Derek.
As you move around to the schools, for those of you who are newer to the board, I asked the principal of that school to be there to give you a tour and to give you some information about their school.
Yeah.
So the internal pieces is now built into your calendar.
Well, and if we as a board don't feel like those other opportunities are being scouted out to all of our kids, then we need to make that a point to Jean and the rest of the administration to make sure that that is happening.
True.
I would even go beyond that and say that we have to do a sales job for kids. The kids can be incredibly passive, and they're prisoners of their phones quite often. And anything to break through that is good. And I don't have necessarily any fantastic ideas about how to do that, but I think it needs to be a discussion.
Sure. Well, and it's supposed to be. So once we can get Jim in here, or someone else, we'll make sure that happens. Superintendent's report. Does anybody have any questions for Jean regarding that?
It was really nice to see kids in schools
I bet.
today. Full classes,
And it
no
wasn't 100
computers.
degrees.
And
It was a nice
put in that
day.
order way back when.
Yeah.
Can I ask you something that, this is what goes way back to the medical discussion earlier on, but my sense is that the teenagers are tougher to keep, it's tougher to keep the teenagers' masks on than the little kids.
It might get there, but today, no. We had maybe less than a handful of kids. Yeah, I'll turn it over to her in just a second, but we had really just less than a handful of kids arrive either without a mask or with their mask down. We said, would you please put that on, and this is why, and we didn't have any issues with masks. Today's day one, but we didn't have any issues. Did you?
There weren't any serious problems, definitely, but I definitely agree with what you said, that it's a lot harder for teenagers to follow rules than it is for children. And I'm being completely serious.
Yeah, no, we agree. Yeah, we know.
It's very, something so simple should not be so hard. But it is.
Okay. So our next meeting is set for September 15th at Sudbury at 6 o'clock. There is no need for executive session, so I would entertain a motion to adjourn.
Unless, does Padua want to add
Oh,
anything?
Yeah, we haven't done a student rep report.
Well, and the student rep report is not really the student rep report anymore.
whatever you wanna call it.
I want her not to just be telling us what's going on in Otter Valley, but I want her to actually participate in our policies and our discussions, which she's probably not
like
quite
to
ready
know.
to do yet, which is fine. So, and I did talk to her, because I said I would after our August meeting about things that she felt would be relevant to our discussions, and she's thinking about it, and we'll get those to me. I have a list. There we go. Do you want to read your list? Do you have it with you?
It's in my pocket.
All right, well, there we go.
when you saw me the other day, you had asked me to make a list of the things that I, as a student at Otter Valley, thought was missing from where I go to school.
Okay.
And so I made a list of those things.
Awesome.
It's 10 pages long.
It was longer.
I'm kidding.
You're lucky.
She shortened it.
Some of them aren't necessarily what's missing. Some of it is more just annoyances that I have with the school and that I know that other people feel the same about. Number one, faculty job descriptions aren't very clear to students, meaning we don't necessarily know who to go to when we have a problem come up. Like there's the guidance counselors and stuff, but as far as I was concerned for a really long time, the guidance counselors really only dealt with academic things, at least on a surface level. Number two, the AB schedule that we have at school is, every other day classes, and it's not fun. It's not what you want it to be. It makes things so much more stressful and much harder to keep straight. There's a lot more due dates to worry about, especially if you have more than 5 classes in a semester. Right now I only have 5 classes this semester, which I'm very lucky for. But last year it was really nice because we had, set classes for 9 or 12 weeks or whatever it was, and then everything changed, and that was really nice. Number 3, there aren't really enough extracurricular options for students. There's theater, obviously, I do that. There's sports, I do not do that. And I believe there's a podcast club or something that happens after school.
It's new.
Yeah, it started last year, I think, or end of last year. But other than that, I haven't heard of anything else. And I do theater all year round, so that doesn't affect me necessarily. But I know that there's definitely people who are going home and not doing anything at all. There's that. Number 4, there needs to be a much bigger focus on mental health at school. Students around the country and around the world are not mentally healthy. They are depressed and they are anxiety-ridden. Often over school because it demands so much from them. It demands all of their time for the most part, at least during the year, and it demands a lot more than I think that it should. Number 5, there are 0 sexual education / sexual wellness classes. At OV, there is a health class. I can't remember off the top of my head if it's a mandatory credit to graduate, but it's an elective. You don't have to take it. And I have taken it, and it's
like raising a child, right? You have to, it's like the potato sack baby thing.
Not
No.
quite.
Okay.
I haven't taken that. If that's an option. No, but the health class that I took was fine. We talked about, drugs and alcohol and all the standard things that you talk about. But the last time that I remember having a class about, people was in 6th grade. And I didn't need it then, and I think I need it now. Just saying. 6, there are relatively no classes to prepare people for the real world. There really aren't, and I feel like some of them try to. Some of them there is a class that I believe I took last year called 21st century computers or something like that, where it talks about computer programs like Word and Excel and stuff like that, and that's totally cool if you're going into a field or if your life needs that from you. But outside of that, I would, if school is trying to prepare me to be an adult outside of these walls when I leave, it's doing a really bad job.
Have you taken a personal finance class?
I have not, but I know that there are people that have, and they've liked it, but guarantee that none of it has stuck. And that's just, you know.
And it's
I'm
not,
just-
re-
I'm
and
just
that's her
asking.
point, is it's not required, so.
Actually, it is now. If you're graduating after 2024,
Yes.
you need to have
Yes.
that.
2024,
that is
so a
true.
couple
Yeah.
more years.
It is good. Yeah.
Mm-hmm.
That's a good step.
Yeah. There's only two more, I promise.
Keep going.
Number 7, we don't need police officers in schools. They are intimidating and unnecessary. And what did I write down here? Every time I pass one in the hallways, I get antsy and uncomfortable, not because I've done anything wrong, I swear, but because their presence makes me think that something will happen, like it's inevitable. Like, I understand why they're there, and I definitely, like, appreciate it to an extent, but I think that, you know, we could benefit from social workers or licensed therapists or something like that instead of brute force. Because that's what police are. And the last one is a little lighter than some of the other ones. It's introduce sign language as an elective if you can.
Ooh, that's good.
That's a good one.
Because right now there are, I can't remember off the top of my head if Mandarin and like Chinese culture are back.
Not yet.
Okay. But so right now we have French and we have Spanish. Both are 2 really great classes with multiple lovely teachers. I've known all of them in some way or another. But sign language, I think that thinking about all the people that I've ever known who's gone to school here, not a lot of them would travel out of the country, let alone live out of the country or anything along those lines. But staying here, of course, being verbally bilingual is so important, and speaking Spanish would be amazing, right? To be able to communicate more clearly. But I think that sign language is equally important, or even more so. Anyway, that's it.
I've got a question for you, particularly regarding the police one, and I'll want to put my own prejudices on the table here. I come from a police family, and I have a nephew who has talked people out of suicide. He's a police officer in New York City. He, I can't think of the word right now, but he dropped from a helicopter onto the deck of a moving ship to save someone's life. Police officers do a lot of things that go well beyond brute force, and there's a theory in police work called community policing. And the basic idea is that if the community gets to know the officers and vice versa, we have a safer and healthier and a more communal community. And that's the intent with officers here. It's not to intimidate or scare you, make you feel that brute force is coming, or you might get hit on the head by a truncheon. It's to make you feel that the police are there to help you, and that they are part of the community too, and that it's a healthy interaction to be around each other. So my question for you to think about and come back maybe at the next meeting is, why isn't that working? Why do you feel the way you do? And what can we do to make that relationship stronger?
Thank you.
And to add to that is, do you think the atmosphere has changed since we lost Ann Bandy? Do you think that her presence is like different than what the new guy?
I do.
Yeah.
He's fine. I've never personally interacted with him. I would like to put that on the table.
Right.
But yes.
I'm just wondering, because I know Ann Bandy did a lot in the school community and was very part of the student body, and I think now it's more of a physical.
We don't actually have any.
We don't have one anymore.
Oh, we don't have one
Officer
anymore.
Butterfield was pulled pretty quickly when COVID came. And now the Brandon Police, he is no longer actually working for the Brandon Police Force, and Brandon Police Force is woefully understaffed, and we do not have anybody, nor do we have anybody in the wings.
I'd still like to discuss it more, because I,
it'd be a good
the idea of kids being scared and suspicious of the police, or anyone, not just kids, is unfortunate, and anything we could do to make that situation better is.
I think I've always felt that way around police officers in general. Like always. I don't know if that's just something that, anyway. But, but in light of this past year and a half, there's definitely something else that's come up, you know, and there's definitely been, now for me, it's more of a reason to feel this way. Right, given, and I know it's bad to generalize, and I'm really not trying to, but I think that, you know, like I said, because of the past year and a half, 2 years, it's definitely been hard to be all right with that, like having police officers around.
Okay. Well, thank you for all of your,
Yeah,
any
very
other
thoughtful,
comments?
thank you.
Yeah, it was very good.
One other piece is that health is mandated, and we do, at least we have made a conscientious effort of introducing sexual wellness into the health curriculum. That's been an intention, not just of Otter Valley, but of the state of Vermont. So it is a required course.
So is it newly required?
The course?
Yeah,
Health is
since
required credit.
Since she hasn't had it?
The inclusion, possibly.
Oh, you have had it? Maybe it's.
The inclusion of the sexual education, sexual wellness is more recent. I don't know if.
That wasn't covered in my class.
Yeah.
So that might help.
And we actually hired an additional health teacher this year for middle school so that we could make sure that we're covering more topics.
Right. Cool. Any other discussion? So I would entertain a motion to to leave at 8:17.
To adjourn?
Yeah,
I
word
move we adjourn.
Okay, good night, everyone.